Hello, Partnering for Vaccine Equity Learning community members and others working to advance vaccine equity. I'm Bridget Courteau, the Director of Group Learning for the learning community. I'm a white woman in my 40s with dark brown hair, and I'm wearing it back in a ponytail today, and I have a navy floral shirt and a white cardigan on. On behalf of our team at the Urban Institute and our partners at the CDC, thanks for being with us today. We know that securing funding to keep your community-based health programs going can be a really stressful part of your work life. If you're looking to sustain or expand your organization's vaccine and health equity activities, it's tough to even know where to begin. This afternoon's learning session will include tips and tricks that we hope will make the process of finding and applying for new funding a little less daunting. So we're going to start with a short presentation on a recently launched section of the Vaccine Resource Hub that any funding seeker should know about. And then we'll move into a panel discussion featuring representatives from 3 PAVE-funded organizations to hear about their experiences and advice on winning new funding to sustain your health equity work. Next slide, please. Before we go further, I'll review a few key points about how the session will work. First, we do offer live Spanish interpretation during our events. If you'd like to listen to the Spanish language channel, it's simple. You just need to go to the globe icon that's in your Zoom taskbar at the bottom of your screen and toggle to the Spanish channel. You've all been muted upon entry to this webinar. If you have a question for our speaker or the panelists while they are speaking, we ask that you use the Q&A tool. That's also in your Zoom taskbar at the bottom of your screen to submit your questions. It's a lot easier for us to keep track of questions if you use the Q&A. Of course, we do have the chat open today too, and we encourage you to use it to introduce yourself or to comment on what you're hearing, but try your best not to put questions in there so that I can be sure to see them as I'm moderating the panel and make sure that our speakers see them too. And we will have dedicated time for Q&A after each segment of the webinar. So after our first speaking segment, and then after the panel too. And during that piece, you can ask your question live. To do that, you just have to raise your hand. We'll be monitoring to see if we have any hands raised, and we'll take you off mute so that you can speak your question if you prefer. If you have any technical difficulties at any point during the session, please send an email to our community manager's inbox. That's down here, vaxequitylearning@urban.org, also on the screen, because we definitely want to know about that so we can fix them for the future. And finally, as with all of our learning events, we will post slides and a recording of this event on our community website and circulate them through the digests that go out through the CDC-managed Adult Vax program listserv, which all PAVE program members should be a part of. Next slide, please. So it's now my pleasure to introduce our featured speaker for the day, Laura Durda. Laura joined the CDC Foundation in 2020 as a COVID-19 core contact tracing manager, where she partnered with local health jurisdictions, managers across Ohio to coordinate their COVID-19 case investigation and contact tracing programs. In 2021, she joined the Infectious Disease Department as a program officer and began supporting PAVE by leading monitoring and evaluation activities, providing technical assistance to community-based partners in 10 states, and managing the Vaccine Resource Hub. Laura received her Master of Science in Global Health from Northwestern University. She's certified in Project Management for Development Professionals, or PMD Pro, and she's proficient in Spanish. She's lived and worked in Bolivia, Costa Rica, Fiji, India, the Philippines, and Taiwan, and she currently resides in Greensboro, North Carolina. So Laura, I'm going to hand it over to you, and the floor is yours. Thanks for joining us today.
Bridget, thank you so much for that introduction, and welcome everyone. I'm really glad to be here with you today and showing you the Vaccine Resource Hub. So next slide, please. Great, thank you. And so, oh, I see that I'm spotlighted now so you guys can see me. Great. So I just wanted to say I'm a program officer at the CDC Foundation. We actually have built and we maintain the Vaccine Resource Hub. As Bridget explained, it's a public-facing website. It's been created for the Partnering for Vaccine Equity program, but it is open, openly. It's accessible to anyone. And I'm going to drop the URL in the chat so that everyone can, bookmark it for when you're ready to explore it yourself. And so today I'm going to show you some items that may help you to sustain and broaden your programs. So first of all, the purpose of the Vaccine Resource Hub is really to provide resources that are specific, relevant, timely, and all scientifically evaluated. Again, the resources and materials on here are free and easily accessible. We've been curating this content to help strengthen your community engagement activities, including with trainings, webinars, toolkits, social media graphics, fact sheets, and other helpful resources. We've worked to make this site useful for organizations, small and large. Could be the coalition in your community that is working to improve health equity, or it could be a big hospital system. There's something on this website for everyone. We really work to make it useful for organizations who do the community-facing work and oftentimes don't have the time or staff to create their own materials, resources, posts, trainings, things like that. So these things you can immediately upload to your social media, your flyers, emails, newsletters, however you need or want to get the message out to your community or your community partners or even your staff. So that's an overview of the Vaccine Resource Hub. Next, I'm going to show you a few screenshots on how you can operate and navigate it while you're on the website. If you go to the next slide, please. This is a screenshot of the homepage. This is where when you click on that URL, this is where you go. You'll see the most popular features here are indicated by the red arrows. You can navigate to the Find Resources section, the Create Resources section, the Stories section, and then you can also change the entire website navigation language from English to Spanish and vice versa. So this is super helpful, right? If Spanish is your first language, or you're or maybe your staff's first language and you just need to navigate the whole website in Spanish, you can. Next slide, please. So now I'm going to show you the Find Resources section. You're automatically taken to the Discover page, which provides an overview of the various things you can find on the Vaccine Resource Hub. You can browse the trending topics there, the What's New section, which just covers what has been recently added, talking points to address the latest myths and false information that may be circulating about vaccines, and various other resources and materials. All of this may help guide your search on the Vaccine Resource Hub. There is also a link to additional resources, which links you to various other external websites that do similar things, or maybe they have additional content you may be interested in exploring. And then the other thing I wanted to point out was the funding opportunities page. Next slide, please. So this is a screenshot of what the funding opportunities page looks like. The first thing you'll see on there is it highlights a free federal grants management training series, which just provides an overview of the basics of federal awards and federal grants management. If it's something you're wanting to get more of, or learn more about, or learn how to go through the award process and then have a successful program, this is the training series for you. And then on the right-hand side there, you can see we also have a list of open funding opportunities from various types of organizations in the health equity space and community engagement work. You'll see the screenshot here shows mostly National Institutes of Health, as well as the Department of Health and Human Services, but the list is long and it's been curated by our colleagues at the CDC. So take some time to peruse this page and look for any opportunities that may interest you. And if you'd like, we do have that free training series that is open to anyone. And any and all are welcome to take it. Next slide, please. The next area I wanted to show you was the health equity roadmap that we have on the Vaccine Resource Hub circled there. It provides an overview of how to incorporate health equity strategies into your program, any program. It also links you to resources on the Vaccine Resource Hub to do just that. So this gets a lot of traction from our partners, and we're really proud to have this roadmap on the Vaccine Resource Hub. If you're looking to sustain or broaden a program of yours into to have more health equity principles in line, this take some time to look through this this roadmap and see if there's a a spot or some things you can incorporate into a project of yours. Next slide, please. The next roadmap that we have available up on the Vaccine Resource Hub is this engaging diverse audiences, engaging diverse community members. Again, it's a similar roadmap. It summarizes how organizations can incorporate steps or strategies to engage in more diverse community members if that's the direction you or your program or your community needs you to go. And so we're really proud of this one. It just launched, so I don't have any notes yet on how much traction it's getting, but it's looking to be a pretty good one. So one other roadmap that we don't have a screenshot of is very relevant to this group and to this training. It's sustainability planning. So how to ensure your programs are sustainable and the strategies and steps you can take to keep the funding coming in and make it sustainable. That roadmap will be available by the end of this week. I don't have a screenshot of it, but you can always come back here using that URL. And by the end of the week, you'll see the how to sustain your program roadmap. Next slide, please. All right, this screenshot is really an overview of our search feature. So at the beginning of the presentation, I mentioned how you can, the various types of resources we have on the website. Here is how you can tailor and search for them. It's where you'll go to explore all those various resources, materials, and graphics that we have available. You can see that we have a very robust and comprehensive filter function there on the left-hand side. You can also search for, you can search materials for race or ethnicity by a particular language. You can also filter by the type or format of the resource you're looking for. And then, I wanted to highlight this too, because if you are looking to sustain your program or looking to maybe apply for one of those funding opportunities, some of these graphics, if relevant, you may want to drop into your application if it speaks to what your program is doing or complements what your program is doing. This might be a place to go to find like a graphic or something like that to complement your application for additional funding. In the center of the screen here, you'll see that there's a snippet of the resource, a description of it in bold font there, and then below that is the race, ethnicity, and language that it prioritizes and it's available in. So you'll also see circled there at the top right corner of each snippet. Each square is a green banner that says new. When you see that green banner on the square, that means it's been added within the last week. So we do try and update, try and get new relevant materials each week. It may be a monthly update going forward, but you'll definitely have the latest materials available to you on the Vaccine Resource Hub. And next slide, please. And this is my final slide. We also have this amazing chat bot. His name is Robbie, and he's available to help you and answer your questions. If you can't find this recording, if you are unsure of how to do a search, Robbie can help point you in the right direction and maybe even pull some resources for you. So don't hesitate to reach out to him. He's available. You'll see him on, you can find him rather on the homepage and clicking on this blue banner that says need help, and then Robbie is there to assist you. So that's an overview of the Vaccine Resource Hub and how organizations can use it to sustain and broaden their programs. I appreciate your time. Let me know if you have any questions, and I'll pass it back to the Urban team.
Thank you very much, Laura. And we, while Laura was presenting, realized that our interpretation, we're having some technical difficulties with it. So we have stopped screen sharing to see if we can fix those very quickly with our host, Zara, who's working on that now. So Zara, have you been able, I think I might have seen that Daniela was assigned as interpreter. Have you been able to sort that?
Yes, she should be in the channel now.
Okay, we're good. So I think we can go back to screen sharing. Thank you all for bearing with us. And thank you so much, Laura. I hope that the community and others will make use of this resource. And I know that getting Robbie ready to go was a labor of love for the VRH and the CDCF team. So I'm very excited to see them in action.
Yes, thank you. And I dropped the Vaccine Resource Hub URL in the chat, but it didn't go to everyone. It just went to hosts and panelists. So if someone could get it out to the broader participant group, that'd be great.
Yes, I know Zoom's acting really weird. The chat to everyone just appeared for me, so I'm lucky. I'm glad that that functionality reappeared for us, so we can now chat to our audience. And I'm not sure if we were getting chats from anyone in the audience during that time when I couldn't see you all showing up on my chat. So if you've chatted anything in the last like 15 minutes and you haven't gotten a response from one of us, please try again, because clearly something a little funky is going on with Zoom. And if one of my teammates could grab that link that Laura chatted to the hosts and panelists and make sure that everyone has access to that while I'm doing the intros to the panel, that'd be excellent. But before I introduce our great lineup of panelists, I also wanted to add that our partners at the CDC have also compiled a few web-based resources related to funding opportunities. And I'm going to share a link to a PDF that includes that compilation in the chat, and we'll make sure that this is also part of the materials that are shared on our website associated with this learning session. Urban does use Box for our public file sharing, and I know that doesn't always work for everyone in the learning community, so hopefully you all can access this. Certainly let us know if you can. We'll email it out to you as needed. So I just chatted that, and now it's time to get into our panel discussion. So here's a little bit about our awesome lineup of panelists. So I'm going to introduce them in no particular order, starting with Kate. So Kate Hilton Hayward joined the Korean Community Service Center of Greater Washington, the acronym KCSC, in May 2014 as the Director of Development, having previously served as consultant to the agency from 2006 through 2014. Ms. Hayward has worked in the field of U.S. immigrant and refugee integration for more than 30 years, including over 15 years with the U.S. Committee for Refugees and Immigrants. Ms. Hayward is responsible for leading KCSC's advancement program. In addition, designs, implements, and manages all fundraising activities, public relations, and marketing plans for the agency. Ms. Hayward was educated at Cheltenham Ladies College in England and Barnard College, Columbia University in New York City, where she received her Bachelor of Arts in Art History and Studio Art. She graduated summa cum laude with a Bachelor of Science in Psychology from the University of the District of Columbia in 2017, and is a member of SciChI, the International Honor Society in Psychology. And we also have Heatherlyn Uphold, who is an assistant professor at Michigan State University, where she translates research into practice by using community-engaged dissemination and implementation science and integrating novel strategies into the discipline of public health. Dr. Uphold is specifically interested in reducing the research to practice gap and improving information and data equity through audience-centered messaging, distribution, and culturally sensitive strategies. Dr. Uphold leads the CDC-funded National Network to Innovate for COVID-19 and Adult Vaccine Equity, which has the acronym NNICE project. And that project focuses on building the evidence base of effective interventions and strategies to improve vaccination coverage and reduce racial disparities in adults throughout Michigan and North Carolina. Working alongside its partners, the NNICE project has reached nearly 10 million individuals, providing critical information and resources to increase vaccine confidence. And Dr. Uphold's research interests also include addressing cancer disparities, normalizing data disaggregation to identify disparities, and improving EMS service delivery. And last but not least, Lydia Isaac is the Vice President for Health Equity and Policy at the National Urban League. Dr. Isaac has a faculty appointment at the Johns Hopkins Bloomberg School of Public Health. She recently served as an associate research professor and executive director of the RWJF-funded Health Policy Research Scholars Program, where she was responsible for the day-to-day operations and curriculum development. Previously, she was the Director of Policy and Health Systems Analysis in the First Deputy Commissioner's Office at the New York City Department of Health and Mental Hygiene. And in addition, she's worked in healthcare, where she was the Director of Quality Improvements and Grants for HIV Services at the New York City Health and Hospitals Corporation. Dr. Isaac has worked in local and state government throughout her career and in academia, where she's taught classes on community health assessment and the social disparities in health. She has a bachelor's from Princeton, a Master of Science degrees from the Harvard School of Public Health, and a doctorate in health policy and management from the Johns Hopkins Bloomberg School of Public Health. And her research interests include advancing health equity through translating research into policy and practice, investigating the mechanisms that lead to racial and ethnic health disparities, and the social determinants of health and neighborhood environment and its role in health promotion. So as you can see, we have a lot of experience and expertise here, and I'm really excited to get into our panel questions. So thank you all for agreeing to share your experiences with us and for taking time out of your afternoon for this panel. And the way this will work, I have a series of first kind of what we call quick fire questions. I'm going to ask each of the panelists to answer in just a few sentences, a few questions about kind of their organization's proposal strategies and finding funding strategies. And then I have a few of those quick fire questions and then some longer form questions that are more about kind of what makes a proposal stand out and some of the aspects to consider as you're kind of putting together hopefully a winning proposal. So welcome panelists. And again, I introduced you in no particular order and I will call on you in no particular order. So I'm not picking on anybody by asking them first. I actually see Dr. Uphold, I see you first on my screen. So we'll start with you and let's talk a little bit about identifying funding opportunities. So I know you work for a university, you have to identify your own funding opportunities, but you also help subrecipients, help other organizations and support other organizations and may also be responsible for helping them identify funding opportunities. So how do you know where to look for funding?
Yeah, absolutely. So I should also say that I am a white cisgender female with gray hair and a red shirt on today. What is so critical to, I think, all of our work is maintaining relationships with partners. So I can't point to a particular website that we go to other than the Vaccine Resource Hub, which is amazing, and we go there all the time, but that we stay in communication with our partners, not only to identify needs, but also opportunities. I love it when a community partner sends me something and says, hey, let's do this together. And we do the same, right, as a research partner. So we're always scouring listservs and, you know, stuff like that, but it's a shared experience. It's a shared mission.
Mm-hmm. Great, thanks. And Kate, how about you? I see you next on my screen. Do you have any tips for finding funding opportunities? You are kind of based at a smaller organization. And so what might be the same or different about your approach?
Sure. We're an ethnic-led, community-based organization, and we don't only focus on health. We have a health division, health and mental health division. We have a family services division, that focuses on domestic violence, and we also have a social service division. So each of those divisions are led by a director of that division. And we kind of use a group approach, or I guess a group think approach, if you will. We have a development team, which includes our executive director, the finance director, and then all of those three division directors. And we all keep our eyes and ears open all the time for opportunities. I think this hub that we just learned, or that I learned about, sounds fantastic. I would definitely look there regularly for, especially in that funding opportunity area. We are definitely a part of various coalitions and working groups, and we're on dozens of listservs. We all are. So we all find out about things through those listservs, and then we just shoot it to our group and say, hey, is this something that you think interests you? We all try and read the RF, different requests for proposals and NOFAs very carefully to make sure that we're eligible, that it's something that's in our purview or our knowledge base, that we have experience in. And then we kind of make decisions on that basis of what we want to go for. I think that's really the gist of it. Just mainly keeping our ears and eyes open. Also, our funders send out notices all the time. So if you have funding, for example, from the Office on Minority Health, you'll get information from them regularly about what opportunities they have. And we just, we're hooked into like grants.gov and all of these different places. So we find out there's no shortage of opportunities, I think. I think the main thing is to try and figure out what you can do, what you're good at, and who you can partner with. I think partnering is really, really essential. How you can do write the best proposal for that opportunity.
Excellent, thanks. Okay, and Lydia, you also are kind of based with a large organization, but I know you have a lot of smaller affiliates, chapters. I'm not sure how you all refer to them in National Urban League, but that you're supporting smaller groups too. So how would you answer this question about finding funding for kind of the headquarters, and then, how you would support your affiliates or your local chapters in their funding search?
Yeah, thanks, Bridget. So Lydia, I'm an African-American female, hair back in a ponytail, wearing a striped white and black shirt. So I want to ditto everything that that Heatherlyn and Kate said, but I think also making sure that you think through their partners. So, we've had a partner, and, however you feel about them, with a pharmaceutical company that has really taken a long partnership. It took a long time, but we got a successful proposal because we came at them not with a specific funding opportunity, but a conversation. We just started a conversation with them about what they were interested in funding. And so I think, because I don't want to repeat what our other panelists said, which are great, but also forming partnerships with funders that may not have a funding opportunity, but know you. And so because they know you, they come to you and they say, hey, I have this opportunity I want you to apply for, or I'm really thinking about forming a partnership with you. Let's talk about what it is that we can do together. And so those are ways, particularly people so for national, that happens in national, and we're on grants.gov, and we're in, we talk with all the national foundations, but also a lot of folks, we have affiliates. So we're a historic civil rights organization. We have 92 affiliates in 36 states in the District of Columbia. And one of the things that we talk with our affiliates about is who is the local foundation or funders. All states and all localities have people who just fund, for example, in Kansas City, right? Or just fund in Oakland, or just fund in Miami. And so also connecting and finding those local funders, those local small foundations, to start learning about and partnering them and figuring out what it is that they're trying to fund. Because just like Kate, I'm the VP for health, but we're an organization that has 5 different pillars, but we also have development folks, partnership and advancement people who help us on, some of the larger grants, but also smaller grants. And a lot of times, even the large organizations are situated somewhere, right? So a lot of times they'll say something, well, we're interested in this region, even though they're a national company. So don't think a national company is not interested in you because they may have regional offices or regional interest that they're willing to fund. And so I would just say, well, I'm going to leave that for the last. I have one thing, but I know our last question is the last thing we want to say, so I'm going to leave that for last. Thank you, Bridget.
Okay. Thanks to you all. And so let's dig in a little deeper to talk about, you found an opportunity, and the sort of the level, the leadership level that needs to approve staff for working on a proposal or needs to say, yes, our organization is going to go for this. That decision has been made. And now what? How do you figure out who works on a proposal? Like, how are staff assigned to a proposal? Who takes the lead, and how many people, basically would it take? I know that's going to vary based on the size, but think of like a typical proposal writing process and how you would staff it. Kate, I'm going to start with you this time.
Well, I think a lot depends on if it's a major federal grant that we're applying for or a smaller foundation, local foundation type of funding. But just thinking about a large federal grants, that's really, again, a big team effort. We have our development team, as I mentioned. And usually I'll be the person as the director of development, I'll kind of shepherd the whole process through. But our program directors really are the ones that come up with the concepts, the program design. They know what best with their staff, what the needs are for their community. And so I really look to them to come up with, the concepts, like what is it that you want to, what is it that you want to do? Again, a lot depends on what the funder is interested in funding too. So it depends also on what the request for proposal looks like. But besides the program director, they'll usually come up with the program design. They'll create the logic models, the work plans and the timelines, that kind of thing. We have a finance director and his team will come up with the budget based on what that program design looks like, based on how much funding is out there and how large a staff is needed to implement the program, like what the staffing pattern looks like. The executive director, she oversees everything and makes sure, puts the stamp of approval on everything when it's in the draft stages. And also she usually is the person who will, with our partners, she'll ask for letters of support. She'll kind of shepherd the process for getting memorandum of understandings done and letters of intent and that kind of thing. And as I said, I'll shepherd the whole process. So I'll usually be the one who puts all the attachments together, makes sure we've answered every question appropriately. Like I'm the one who reads the NOFAs and the RFPs, like with an eagle eye to make sure we've answered every question and, dotted every I, crossed every T, because we don't want to be disqualified because we left out a section or we missed an attachment or that kind of thing. So yeah, that's basically the process. I do most of the writing as well for the grants, even though the program people will come up with a design. I usually do draft all of the narrative language.
Mm-hmm. So does a program team provide you with kind of an outline
Yes.
of the ideas, and you'll kind of craft it in?
Exactly.
Given that you've obviously have decades of experience doing this, so probably that sounds like an efficiency move to have sort of someone take an outline, someone who's used to kind of proposal writing.
Yeah. As I said, I need them to tell me like what kind of timeline are they looking at, like what are the main things that they want to do, and then I will craft it into the language. And I also have a lot of stock language that I can then adapt. So I have like the organizational capacity language that we use for almost every proposal, but we craft it to whatever the specific grant opportunity is to make sure that we're addressing what they're looking for, and also what our expertise is as a culturally appropriate bilingual bicultural organization.
Lydia, how does that process sound similar to what the process that you all take? I mean, sounds like a team effort, which I imagine is probably pretty common across the organizations, but is there anything that stands out as kind of distinct or different from what how the National Urban League kind of approaches staffing and who would work on a proposal?
Yeah, so I'll give 2 examples. So our team at the National Urban League, the health team is pretty small. It's about 3 of us. And so when it comes to health proposals and it comes to federal grants, we are usually the ones who write it and shepherd that whole process through. But for example, our private grants, if it's a corporation, pharmaceutical firm or a foundation, our development team does craft that because they would have started with some conversations with them to even bring them in. So they kind of know what the foundation or the corporation is looking for. And so, of course, just like Kate said, we will give them ideas. We work hand in hand with our development team to really give them also what our like strong kind of strategy is, what our health strategy is, what we're trying to fund, so that they kind of know, okay, this is not going to work. So they're wonderful of like kind of weeding things out that like, I'm not going to even bring this to Lydia because it's not going to work for her, right? So it doesn't make sense. So it is a similar process. But I would say, for example, our workforce team, which is a much larger team, when they go for federal grants, similarly, that team writes it, but they pick one person who's kind of spearheading it, like Kate is for her organization. But then the whole workforce team, they each take separate parts, but that person makes sure they bring it together. And then at the end, our development team similarly looks through it, makes sure everything's there. Our CEO and president signs off on it. And so it depends on the size of the team. The smaller teams, we kind of have our hands in all of it. The bigger teams have separate people doing different things.
Mm-hmm. That makes sense. Evelyn, what would you say? Is that
What do you
a
add
similar
to that?
process?
Right?
Well,
Kate and Lydia did
yeah,
such a good
I'm
job.
hearing that there usually is this kind of central, more administrative person or head lead that is like the final compiler, reviewer, editor. And so wondering first, is that the same for you all? Is there kind of this head honcho that would be the last person looking and know where to grab all this stuff?
Head honcho. Because I'm going to take that question, I'm going to tweak it just a little bit because it depends on who the submitter is, right? Very often I'm a sub-awardee from the community organization and they are the submitter. So I'm going to back up and say it really depends on also the capacity of my community partner who's in the field doing the work. So if they're at capacity, but we still want to go after this, then I will take on more of the writing just to get that part done. But we do it in a shared document so that if they aren't able to attend meetings or do something like that, they're at least able to see what's being presented, see what we're proposing, and that just increases transparency. And I got to tell you, if you're in a relationship, this sounds like dating advice. If you're in a relationship with a partner and there isn't that level of transparency, I think it's an indicator for future interactions. You need to be aware of what's being submitted.
Yeah, for sure. So panelists, in the interest of time, and because the long form questions are so interesting, I'm going to skip our third quick fire so that we can get to kind of some, to talk a little bit about some things that you think have made your successful proposals stand out. So Heatherlyn, why don't we kind of start with you since you were just on the mic. So kind of think about a recent proposal that you won that you're proud that your organization was successful with. And what do you think made it stand out?
Our partners. You knew I was going to say that because that's just the plain truth.
You had put together a great partnering team.
Because what they add is a real understanding and a depth to the scope of the problem that we're looking to address, that as a researcher, I'd go to the literature, I'd talk to other researchers, and that just doesn't, come on, that doesn't cut it. We need community voice. We need that realistic understanding of what's happening in the field. And that's what our partners provide.
And as a follow-up, what was a barrier that you kind of encountered when you were writing that proposal? Clearly, if it was successful, you got over it, but like, did anything come up that was unexpected and how did you deal with it?
Yeah, so actually we submitted for a totally different, this was my mentor, Deborah Verholden, who put in the submission. We submitted for something completely different, didn't get funded, and then had the opportunity to resubmit, because that brings up something, what happens when you don't get funded? right? But you
Mhm.
still need to maintain that momentum because you know you're going to submit it someplace else, right? But you need to maintain those relationships, and that was one thing that we did. So we didn't get it, but we continued to talk about it. We continued to engage with our partners, and then we're able to resubmit.
Yeah, so
Don't
don't
give
give
up.
up.
Yeah, yeah,
Because
yeah,
a
exactly.
lot of that
Ditto.
information can be
Yeah.
reused, even if it has to be reshuffled. It sounds like y'all could almost submit the entire thing as a whole piece, which is great. But certainly there could be other opportunities. So,
Yeah.
not to get too down. And Lydia, what about you? If you think about a successful proposal that you've won recently, what do you think made it stand out?
Yeah, I think it's similar to Heather Lynn, but for us, it's because we have affiliates all over the country, and I think our experience on the ground has really shown through in our ability to get proposals funded. So the work of our affiliates, how they do the work, the commitment, the passion. We have, I would say to anybody in this group, make sure you have testimonials. We had videos, we had things that we were able to share with the funder that showed the work that our affiliates were doing on the ground. So even though we were applying as the National Urban League, we knew we were going to sub-grant out to our affiliates, and we were able to show, one, that our affiliates could do the work, two, that we could help them build capacity in doing the work, and three, their passion and their drive, and also that they can actually connect to communities. I think particularly now in the work that we're doing, I see, at least I'm seeing from, federal agencies and other agencies, that people want to make sure you actually are serving and connecting and can get to the communities that need to be most served. And that was, I think, what we were able to show. And particularly was around our COVID-19 work, that we were able to be on the ground, stand up vaccine clinics, pop-up clinics, PPE clinics, information clinics, signing up for things clinics, going out into the field, going to people's houses. I mean, our affiliates were so innovative. We had one affiliate decide to use an ice cream truck to bring the kids in, and you could bring the parents out so then you can talk about vaccines. Like, what people did, their innovation, their creativity, I think is what really helped make the message that we can do this, and we can do this on a large scale.
Yeah, and it sounds like it was more than just like writing it in a paragraph. You actually try to think of tools and ways to, like, real true evidence to show that you have those connections, not just a sentence in a paragraph or in a narrative. Kate, what would you add about kind of thinking of a recent successful proposal and what made it stand out in the crowd?
Okay, well, one thing that I'm most proud of this year is that we received a CDC REACH grant. REACH, it stands for Racial and Ethnic Approaches to Community Health. Now, one thing that I have to say is you have to be able to tolerate rejection if you work in if you're a fundraiser. And we had applied for REACH funding 5 years ago, and we didn't get it. But what we did do is we got the independent panel reviewers' notes, and we read those very, very carefully and tried to address any of the things that they call weaknesses, as well as sort of like focus also on our strengths, the things that they thought of as our strengths, and try to really emphasize that as well. But the reason we were successful, I think, too, is we had under our belts 5 years of working on a project that we call Project Shine, which is staying healthy through improved nutrition and exercise. And the REACH grant was focused on nutrition, family weight management, and exercise. So we were kind of like perfectly suited this year to apply for that funding. And so, yeah, I was very proud because we were only one of 2 Asian organizations that got funded nationwide. I think there was maybe 40 or 50 organizations that are not organizations. Most of them were states, universities. There were very, very, maybe 2 or 3 community-based organizations that got funded. So I guess I'm most proud of that work because first of all, we got rejected the first time, and then we got it the second time. So yeah.
Well, congratulations.
And
I know
a research project, by the way. It's more focused on research and changing structures rather than being like a direct service grant, which is what we usually do.
Yeah, so it's sort of getting you into a new field, and often that
Right.
can lead to more funding. Got to get a foot in the door. I know that from being a proposal writer myself. So I'm here. I know we're running a little short on time, so we're gonna kind of move to kind of a wrap up. But I'm gonna and you all can add to this. But I'm hearing some kind of words of advice already. So I'm gonna share some of those things that I've heard you say, and then ask you each to kind of add on, or if you have some final thoughts on advice you would give to people looking for tips on proposal writing. So certainly, one, you'd say get feedback from your reviewers and use it. So don't just get it, but use it, even if it's a couple years later. But you have to be used to the rejection and then use the feedback. Invest in your partnerships. I know the earliest part of the panel discussion talked a lot about that. That comes first, and you might even not even have a funding opportunity yet, but still invest in kind of finding common ground and common interests, and use that. Use tools like videos and testimonials, and think outside of the box as you're crafting a proposal. Ways to get interest and show that you actually have the community connections. And then also one other I heard was think about how your current and your recent projects can have positioned you to do new projects, kind of like building on what you're already doing and what you've done well, because that's going to be the easiest kind of evidence that you can do this new project and be successful. So what would you all add? Heatherlyn, you can start us off kind of as any additional advice, or if you want to elaborate on any of the tips I've just shared.
Yeah, the one that I had in my head was the one that you just said. So
Okay.
build in those Easter eggs and do it so if you're a researcher, that's how I build sustainability, and I provide technical assistance and all of that stuff for my community organizations, so that whatever we're doing, let's look at that intervention as applied to other challenges in the community, and equip your partners to tell the story of the work that they've been doing with you.
Okay. Lydia or Kate, either of you, if you want to jump in and add, whoever wants to go first.
Go ahead, Lydia.
Okay, thanks, Kate. So ditto to everything. Actually, you said, Bridget, everything I was going to say. But one of the things I want to echo what Heatherlyn said is don't just go after funding to go for funding. Make sure it's something that you are doing, that your organization's passionate about, and that you want to continue doing, because it's so much harder to build up, unless it's something you want to go into, but it's so much harder to build up something that you didn't want to do. So I would say there's lots of funding out there for things that you want to do, just finding it and tailoring it to the things that you're already doing, because then you'll always do it well, and it won't be a challenge to come up with the metrics or the measures. So that's the other thing. And the other thing I want to highlight is what Kate said about getting the advice. Foundations don't normally give you a reason why you didn't fund, but federal government has to. And so get those notes, talk to program officers, because we had a situation in which same thing, we didn't get funded. And then the next round around, they came back to us and said, hey, apply for this. We like what you did, fix these things, and we think you'll get funded. Now, they didn't say it was guaranteed, but then we did reapply and we did get funded. So it's really important to get that feedback.
What can I add to what's already been said? Just some practical things, like it's really good to take a grant writing class to learn, because it's a very technical skill. It's not like you're writing a novel and you have to really follow the guidelines of the RFP, especially for federal grants. You've got to read everything really carefully. I can't emphasize that enough, to make sure that you are answering every question that they're asking, because they assign points to everything. So also don't spend hours and hours on a section that's only got 10 points, right? Put your emphasis on the sections that have 30 points or 25 points. And then, practice makes perfect. Keep trying. Don't, you can have a thick skin, and if you get rejected once, keep trying. And besides the grant writing, I would also, the storytelling, I think Heatherlyn mentioned that as well, is really learn how to tell the story of what you do and of your community, like what their needs are. And if you have the successes from another program, try and use that and bring that into a new proposal that you write. So I think those are my tips. tips of the trade.
Excellent. Well, I really appreciate you all sharing those experiences with us, tons, and we could go on and on, but I do want to make sure that we're already a little past, we thought we could keep this to 45 minutes, but we're not that successful at that aspect. I haven't seen questions come into the Q&A. I know we were having some Zoom challenges earlier, so hopefully it's working well. I will give a couple of minutes because we're going to do a satisfaction poll, so we can also see if any questions come in that way, but and folks can use chat too if they'd like, since there's not a whole lot happening in there, so we'll definitely see your question, and I'm not seeing any hands raised either, but I'll give it one more minute. And Zara, if you want to launch the satisfaction poll, we do use this for our reporting, so appreciate if you all could take just a second before we close and fill that out for us.
Looks like there is a question about a recording.
Okay. Yes, the recording will be available for future use. So it takes us a day or two, but then we put this recording onto our Partnering for Vaccine Equity website, and that is a members only website, and so we will also share it with the CDC so they can circulate it through the Adult Vax Program listserv, which is a much broader group. Okay, I'm not seeing any other questions coming in. I think you've given the audience a lot of how long is the video? It would be about an hour. If you're talking about this video from this recording, and we will provide the Spanish language and the English language video. We always provide both of those. So if we go to the next slide, we just have one closing. Oh, the video for the grant application. Oh, that might be a reference to Grania. Do you know that could be a reference to your to one of the
I don't know
resources
if-
that you linked?
Yeah, I don't know off the top of my head, but I know it's in the resource document that we shared with you, and I believe it's also on the funding opportunities page. So you're welcome to click in and check, but I'm not 100% sure now.
Yeah, certainly I invite anyone who may have reviewed that video to share in the chat about how long it was for the question asker. So this is the last session that we, the Urban Institute team, are going to host as the PAVE Group Learning Manager. You might be aware that the Urban Institute won't be participating in the program any longer starting next week. And so on behalf of our team, I did want to take a moment, since this is our last learning session, to just express gratitude for all that you, our learning community, have done to make the community a success over the last few years, from sharing resources and events on the community's website to offering to share your experiences and expertise with us through group learning sessions like our panelists did today, to leading our communities of practice. For us, it's always been about supporting you and the inspiring work that you're doing. So it has been a privilege to work with you, and we wish the entire learning community and all the others who join us who are working on vaccine equity the very best of luck as you continue doing your very important work in communities across the nation. So thank you very much on behalf of our entire team. And thank you, panelists, and thank you, Laura. Thanks all for joining us today. We hope you have a good rest of your afternoon.